If your feet are killing you at the end of the day, don't throw out your heels yet. Instead, let's talk to Dr. Tammy Chapman of the Neurologic and Orthopedic Hospital of Chicago. Dr. Tammy, what are the common foot and ankle injuries that you're seeing?
Most commonly, we see bunions, hammer toes, neuromas, plantar warts, these type of things in the foot. And in the ankle, we see inversion or twisting of the ankle, especially with heels.
Well, and talking about the foot and bunions, what is a bunion? I've had people who say they've had bunion surgery and it's extremely painful, but what is it?
Well, a bunion is actually where the first metatarsal, this big bone here, comes a little bit outward, and then the big toe kind of compensates, and then it makes it more of a quite painful in shoes. So it just becomes like this big prominence or bump.
And so how do you fix that or repair it?
Well, there's different ways to repair a bunion, and it depends on x-rays and what we actually measure out. If it's a quite big bunion, we have to do the cuts back at the base to make a bigger correction. If it's a smaller bunion, we do the cuts down toward the big toe.
That's interesting. Now, we talked about tight shoes, and you had mentioned to me earlier that a hammer toe might be able to be prevented without some really long usage in heels. So what is a hammer toe?
A hammer toe is whenever the toe is bent up and hammered like this, and it rubs in the shoe, and after a long period of time of wear, it can actually fuse.
Oh, that sounds quite painful. Well, I don't wear heels very often, as I told you. I'm in gym shoes most of my life. But what are some of the common ankle injuries? Because we see that in athletes, we see it from women in heels. I don't think there's many men in heels, but tell me about that foot.
Well, actually, when we wear a heel, we have to remember that we're putting a lot of the weight from the tibia, which is this bone here, in the ankle, and not much on the fibula, which is normal. But when we twist, we normally crack what we call the fibula bone. And it's very painful. People think because they can walk on a fractured ankle that it's not broken, which is a misnomer. Definitely, just because you can walk on something does not mean that it's not broken.
I actually had a 12-year-old gymnast that for a week limped on her foot until I begged her to have an x-ray, and she did. She had a broken foot. It just seems just crazy that you wouldn't be able to know it's that painful.
Yes, I always recommend, even if you hurt your ankle, to get x-rays of the foot, because there's a major tendon that wraps around the outside of our ankle and does hook into the foot. It's called a Jones fracture, quite common in athletes, gymnasts, and dancers.
Well, what are some things we can do to take better care of our feet?
Prevention. Sometimes you need a custom orthotic put into the shoe, maybe to prevent something going on in the foot or abnormal activity in the ankle or rear foot, as we call it. Wearing like a supportive ankle brace is sometimes good for certain sports where you use a lot of the ankle. And just prevention is probably the best thing, and buying a pair of shoes that you have enough room in what we call the toe box and good support on the arch.
So are you telling me that I totally have to throw out my heels, or can I wear them maybe a couple hours a month?
You can wear them sparingly, like if you're going to a special event, but keep in mind you wouldn't want to walk too far in them because they're really not for that.
Well, we'll definitely get some good supportive, wide toe box shoes. Our feet will feel better, and we are so appreciative of your good advice. So take care of your feet by being fit and wear your gym shoes, and save those heels for special events. There's more to picking a shoe than just the color or style. Fitlosophy is a concept by Fleet Feet Sports, and Dave Zimmer is going to tell us a little bit about that. Dave, how do we get fit for shoes?
Well, first thing we want to do is measure your foot. Get the correct measurements of the length and width of your foot to make sure that we're getting you into the right shape and right size shoe. So we're measuring your foot, and we're seeing that when you're seated, you're measuring out to about an 8.5 on your length. Your second toe is a little bit longer than your first, which is called a Morton's toe, which means you're from royalty or married wealthy, one of the two. And you have about an 8.5 on your width as well. Now we want to measure you in a standing position because we want to see how much pressure you put on your foot. As you put pressure on your foot, your arch will have a tendency to drop. The more that your arch drop and the shape of your foot changes, the different types of shoes we want to get you into. So it's not just picking your shoe based on the color. It's picking it based on the shape of your foot and also the function of the activity that you're doing.
And it makes so much sense because you want your body to be able to move in a function in unison with that shoe and have it actually help your workouts instead of being a hindrance.
When we're picking shoes, we want to make sure that we have enough space in front of your longest toe, which is why I mentioned the Morton's toe. Generally somewhere between a half to a full thumb's width in front of that toe. So as you're putting 7 times the force of your body weight as you're running on top of your foot, your toes have a place to go instead of just into the front of the shoe. It's going to make it much more comfortable as you're doing your workout and also help prevent injuries.
Well, quickly tell me about the treadmills because the treadmill test is something that looks so unique.
At Fleet Feet Sports, what we do is we put you on a treadmill and we watch you run. We want to see you in motion because that's the activity that you're going to be doing. We'll record your running as you're on the treadmill and use our software to be able to slow it down and freeze frame your foot as it's making contact with the ground. As we see your foot striking the ground, we can understand the motions and pressures that you're putting on your body and once again, make a better selection of footwear.
So once we've gone through the treadmill test, how do I figure out which shoe then is next?
There's 4 different types of shoes that you have the ability to go into. They are flexible, neutral, stable, and controlling. And depending on how much motion or flattening of your foot that we see is dependent on what shoe you're going to go into. The higher your arch, the more neutral or soft the shoe. The flatter the foot, the more stable or controlling the shoe.
So this really is down to a science, this fit philosophy. And it's also a great way to understand that you just can't go off and buy a shoe off the shelf. You really need to get fit for your shoes because they're what connect you to the ground and make your movement patterns correct. So check out our website, fittodaytv.com, and get tips on fit philosophy from Dave Zimmer at Fleet Feet Sports Chicago.